As child life specialists, we provide support to patients and their family members while they are undergoing medical treatment here at the hospital. We wear many different hats here in the hospital to best support our patients and their family members, some of them being preparation, education, procedure support, therapeutic interventions, developmental play, as well as bereavement and end-of-life support.
You prepare for a lot of things in life, and these things are really difficult to prepare for, right? I can't imagine what it would have been like without child life.
A child's hospitalization affects everybody. Child life is such a unique function in that it supports the whole family.
When a family first comes to the hospital, whether it be through clinic, through the emergency room, or being directly admitted to the unit, they are trying to navigate, what do I do? What are the next steps? And it can be very overwhelming. We can step in and help families kind of figure out what are these next steps.
A big part of our job is education, preparing kids for what's going on, talking in ways that make sense to them. They might not understand the doctor's lingo, but we can break it down. We have pictures, we have stuffed animals that have tubes and lines, and we can do medical play with children to help them understand what's going on.
The more kids know, the more they understand and the better they cope. And so as child life specialists, we want to empower kids while they're here in the hospital to take back some of the control that you just naturally lose being in the hospital environment. So in addition to providing preparation education about their diagnosis and about what's going to happen to them during procedures, we also want to teach kids independent coping skills for procedures and just overall coping with being in the hospital in general.
When you work with them and they're able to do something with our support, and then they have a coping strategy in place that the next time they're able to do it with their family support, it's very rewarding, and we're just as proud of them as the parents are.
One of the ways our child life department is unique is that we have several child life specialists in our specialty clinics. And in those clinics, the child life specialists are able to help with procedure support, helping follow up with kids after their hospitalization, and then also just helping kids navigate what it's like to have to come back to a specialty clinic. We provide a lot of support to siblings when they're here in the hospital, but sometimes also when they're at home because they're not able to be in the hospital visiting their sibling or be with their family. And so a lot of times we actually get to work with siblings face to face, and so doing that same preparation, education, medical play with the sibling that we would do with the patient, but then also offering them an outlet to kind of talk about what's happening with them.
Child life always just checked in. How are you guys doing? Is there anything we can do to help? We would try to get Bree here almost every day to see her sister and just to be a family together in the hospital. And so they'd be really good about, hey, come to the toy closet. There's stuff, games and crafts, and just keeping her busy. And so to know that Bree was somehow processing all of this in a positive way was amazing.
As child life specialists, we try and normalize the hospital experience for the child. One way we do that is different events here in the hospital. And in 2018, we were very fortunate to open up Kyle Rudolph's End Zone, which is a therapeutic play space in the hospital for our patients and families. And it's a space where kids get to engage with their brothers and sisters or if they're friends that are visiting, and they get to do very similar things that they would be doing if they were at home and in school. And it's a space that allows kids to be kids.
Sometimes our families come to us and their child is seriously ill. It could be something that is out of the blue, brand new, or it could be the end of a chronic illness. And so what I like to think is we help families navigate this end-of-life journey. There are things like memory making, legacy making, and families may never have heard of this before. And there's just gentle ways of having those conversations with families.
We kind of play a different role for everybody in the family during the end of life, but really making sure that they have their emotional needs met, and just making sure that the family feels well supported throughout their whole experience.
All the families that come through this door can benefit from child life, and everybody that has a child hospitalized deserves that type of support.